Good evening, everyone. I hope my screen is visible and my voice is audible. Someone please respond.
Yes, Didi.
Okay. So today we will be dealing with all the three miasms, but according to Robert's point of view. Just a second. So by classification, we all know about the taxonomical classification of plants, okay, given by Linnaeus. Then we know about the Cuvier's uh, classification of the animal kingdom. He classified the animal kingdom into vertebrates, molluscus, articulates, and radiates. That's a different thing. Like that, Hahnemann had classified disease into four great divisions. First was all the diseases that came out from mechanical and the exterior sources. Mechanical and exterior sources means this included the fractures, then strains, then any abnormalities or any indiscretions of diet, any external poisons even. Okay. Then extremes of the weather conditions, extremes of thermic conditions like sunstroke, frostbite, etc. These classification of diseases, they are mostly self-curative. They are self-curative, and we can use medicine in these cases to hasten the cure. So medicines can be employed to hasten the recovery. These are self-curative. We can be cured of them. We can rectify it by regulating the environment and the habits. Rectify by regulating environment and habits. But if we use medicine in these cases, it will be a quicker recovery. The rest three remaining groups, Hahnemann gave the term miasms. Rest three groups are known as the miasms. These are the four divisions. The common definition of miasm is the polluting exhalations or malarial poisons. So here we know that one is non-venereal, that is the soda. Other are venereal miasms, psychosis and syphilis. Here, I would like to tell about the word origin of psychosis. Psychosis comes from the Greek word. It has its word origin in a Greek word, which means fig. Fig. And this is the Hahnemann's term for constitutional effects of the gonorrheal virus. Now, why we tell psychosis as psychosis and we do not refer to psychosis as gonorrhea, we'll discuss that later. But psychosis is Hahnemann's term for constitutional effects of gonorrheal virus. So those who are noting down, it may seem that I am going a bit fast. If you want me to go back to a certain slide, please tell me. Now only we will get back to that, because we have a lot more to discuss. So it may seem that I am going a little bit fast. Okay. So remember that this is psychosis is the term for constitutional effects of the gonorrheal virus. Sorry. Virus. Okay. Going to the next one. Soda, this also we all know that it comes from a Hebrew word. This is another MCQ question, those who will be sitting for the AIPGT. Hebrew word, sorat, which means it can be a groove, a fault, a pollution, a stigma, which is often applied to leprous manifestations and to the Great Plagues. Now, soda is a milder form of leprosy. This was asked in some question. I have seen this question somewhere, that who is the mother of soda. Actually, it is that leprosy was the ancient leprosy. After that, the milder form is soda. Milder form of leprosy is soda. It runs as soda. So do not get confused when you see mother of soda, because we all know that soda is the mother of all diseases. Who can be the mother of soda? So it is leprosy. So soda can mean scabies, psoriasis, and Hahnemann's term for the itch, dyscrasia. Itch, dyscrasia. This is the parent of all chronic disease. We all know this. It is a parent of all chronic diseases. Now, we all know that soda word, it is very closely related to the term deficiency. Soda is very closely related to the term deficiency. Syphilis is related to the term ulceration, and psychosis is related to the term overgrowth. Okay. So in soda, the great common denominator of all the sodic conditions is that there is lack of certain elements in the system, or there is inability to assimilate them from foods. One is that there will be deficiency, another is there can be inability to assimilate them from foods. Now, soda is such a disease that it is first manifesting on the skin. First manifesting on the skin as skin infection, as eruption. And skin can be regarded as the natural place of manifestation. When it naturally thrives on the skin, it will do least harm. So, all the other skin manifestations like swelling of glands, even swelling of glands also, then any sarcomatous, carcinomatous, tumors, any other skin disease, all the skin disease, then swelling of glands, then sarcomatous and carcinomatous tumors, everything has its source in soda. And this is important, it is the source of almost all the subjective symptoms. So whenever we get a lot of subjective symptoms, a lot of sensation as if, these are all attributed to soda. All these sensations, because soda, it affects on the functional plane. So all the sensations as if we get, it is attributed to soda. Even in the venereal miasms, syphilis and psychosis, if we get these subjective symptoms, it will be present in the degree to which the SORA is present. In case of venereal miasms, when there are subjective symptoms, it will be present in the degree in which SORA is present in the system. Now, this is the introduction part of SORA. We will go to the generally those who are sitting for AIPGT, we tend to get confused which miasm is having which symptom. So we'll get to that part. Okay. This is the most interesting of all. This is the most confusing of all. First, we'll start with the head. These are all the manifestations of SORA. First, we'll come to the head. There are numerous sensations of vertigo. There are many kinds of vertigo and are often induced or aggravated by emotional disturbance. So emotional disturbance, they play a major role. They are brought on or aggravated by emotional disturbances. The general amelioration of anything of sodic nature is there will be desire. Even in vertigo, it is associated that there is desire to keep quiet by lying down. Desire to lie down, this is very marked in all the sodic constitutions. This ameliorates. Desire to lie down, which ameliorates. Sodic patient will prefer rest. And this desire to lie down, this is the characteristic of the whole sodic condition. This is very characteristic of the whole sodic condition. Now this vertigo, as I told, it can be of many types. It can be brought on by any kind of motion. Motion means walking, even rising from a sitting or a lying position, looking up, it can be of these sorts. There can be also from vertigo from bilious causes with digestive disturbances also. This vertigo can be associated. The general amelioration of everything will be this one, desire to lie down, which will ameliorate. Then is paroxysmal headaches. Now the location is very important. Why, I'll tell you. This location is frontal, temporal or parietal in case of SORA. Please note that in case of syphilis, this headache, it will be on the back of head or on one side. And in case of psychosis, it can be on the vertex. It can even be frontal. So these locations are important. This is the location for the sodic headache. The general amelioration again remains same. It is ameliorated by rest, quiet and sleep. And ameliorated by hot application, another sodic characteristic. Anything ameliorated by hot applications is sodic. SORA patient has amelioration from hot applications. This is also the characteristic which is found in feverish children. So this characteristic basically remains the same. Now the external part, sodic head, it is normal in size and contour. Why? Because in soda we will never find anything other than functional disturbances. So whenever there is a deformity, obviously it is not due to soda. So the sodic head will be absolutely normal in the size and the contour. The hair is lusterless and dry. Hair is so dry that the patient cannot comb it properly. And there is premature graying of the hair. It is sodic. This again comes as MCQ. Premature graying is sodic. Premature graying of hair, this one is sodic. And there can also be eczematous appearances like the sulfur characteristic, eruptions which are aggravated in the evenings, ameliorated by scratching, followed by burning. So eruptions can be in the head, particularly like that of sulfur, ameliorated by scratching, burning follows. Another characteristic of it is that the head or the hair, it will appear unclean. It looks generally unclean. This is another characteristic of the sodic taint. So it appears unclean. This is of the head. There will be much itching, dandruff, dry eruptions, very dry, all these things. Eye. Again, we know that there are no function, nothing other than functional disturbances, no pathological changes. So there are only spots before the eyes and refractory changes, ptosis, all these things are not sodic. These are not sodic. Soda eye, they are intolerant of daylight. They are intolerant of daylight, and this is aggravated in the morning, all the eye conditions, and ameliorated by heat. This spot before the eyes, this is the characteristic of sodic miasm. Remember that ptosis of the lids, it is never sodic, but it is syphilitic. Ptosis of lids, it is syphilitic. And when a person has red lids, it is a combination of soda and syphilitic. It is a characteristic of the tubercular diathesis, which is a combination of soda and syphilis. Okay. Next year, the same thing. Nothing abnormally on the exterior part. Appearance is fully normal. Never transparent. There is no moisture in the ear. Auditory canal may appear dry, scaly. Main thing is this characteristic oversensitiveness in the ear of a sodic person or sodic patient. There is characteristic oversensitiveness to sounds. Other than that, there are nothing that is very characteristic because there are no pathological changes. Face, very important. Shape of the sodic face is that of an inverted pyramid. Again, it is naturally, the skin is naturally dry with an unwashed appearance. And the hot flushes at the climacteric or rush of the blood, it is also sodic. Then nose, again the oversensitiveness, characteristic oversensitiveness. They are oversensitive to odors, but lupus of the nose, it is a manifestation of combined stigmata lupus of nose, manifestation of the three miasms. It is closely allied to tuberculosis. Closely allied to tuberculosis. Oversensitive to odors, that means the odors can, he is oversensitive to that point that the patient can be awakened from sleep from odors. He cannot sleep where there are strong odors because they make him sick. So the sodic patient cannot tolerate strong odors. There can be boils, pimples on the septum of the nose, but no malignant manifestations. Okay, I'm going to the next one. Acha, what is soreness? What is this soreness? What does it mean? Shraddha, bolo. Any collection, any collection that is having something bacterial or any food particle, that is known as the sordis. Sordis about the mouth. This is another sodic manifestation. There can be swelling and burning about the lips. Sodic patient has got taste perversions. Sodic patient has got taste perversions. There can be a bad taste in mouth. Bad taste in the mouth. Or there can be regurgitation. This bad taste, it can also be sweet, sour, bitter taste. Remember that soda is the only miasm which manifests the symptom of burnt taste. More or less all the miasms have perversions of taste. Soda is the only one that is having burnt taste. Burnt taste. This is important. Now this soda patient is always hungry. This hunger is very characteristic. Soda patient is always hungry. They crave sweets. This comes as MCQ. Acids, sour things, and in fevers, they even crave indigestible things. Suppose a sodic patient is about to have a bilious attack, and the person is having a craving for sweets. The person is having craving for sweets. Now, after this person craves sweets and this bilious attack follows, we may think that the bilious attack was due to the sweets. Then we are entirely wrong, because this craving, this indicates that a bilious attack is about to come. Sweet is not a cause, but it is an indication. This craving for sweets is an indication that bilious attack is about to come. So this craving is a forerunner of the attack. In sodic patient, craving is a forerunner of attack, and it can also be told as a prodromal symptom. It can also be told as a prodromal symptom of attack in a sodic patient. So before any attack, before a bilious attack, if a person craves sweets, it is not due to the sweet that the person is suffering from indigestion or something, But this craving for sweets was an indication that the person is about to suffer. This is it. Then there is a weak, gone feeling in the stomach. There will be a repugnance to boiled foods, very, very important. They crave fried food and highly seasoned foods, meats, and greasy foods. In a fever, during fevers, psoriatic patients have aversion to sweet and crave acids. Aversion to sweet and crave acids. Most of the soda aggravations they occur after eating. Most of soda aggravation occur after eating. Next, since we are talking about cravings, let us differentiate about the on taking the other miasms also. Just a second. Soda will desire hot foods. Soda is there is a general amelioration from heat, so soda will desire hot foods. Syphilis will prefer cold foods. Psychosis wants food either hot or cold. Either hot or cold. Soda, as we discussed just now, that soda has a desire for meat, but when there is a combination with syphilis in the tubercular diathesis, then there is aversion to meats. So soda has desire for meat, but tubercular diathesis, whenever it is combined with syphilis, there is aversion to meats. So going to the next slide. Cups of soda. Cups of soda are dry, teasing, spasmodic, and annoying. Expectoration, this taste is important. Expectoration, the expectoration is tasteless. It can be mucus, it can be scanty, and it is tasteless. When there is salty or sweetish taste of the expectoration, salty or sweetish taste of expectoration, it indicates that it is a taint combined soric and syphilitic. It is an indication that it is a combined soric and syphilitic taint, tubercular. In tubercular diathesis, we find salty or sweetish taste. This heart condition, this is very important. This came in 2020 UPSC. Sodic patient is the only one who has functional heart troubles associated with a very morbid fear. The patient is so anxious, the patient is so afraid that he will die from this will die. He will die from heart trouble, that he will uh, he will be very conscious of his conditions. He will constantly check his own pulse. But lives on for years. Since the affections are all in the functional plane. It is the psychotic and the syphilitic patient who will die from heart troubles without a warning. Roberts has told that sodic patient is such a kind of a person who lives long and he will produce income for the physician. He will come with this complaint, that I am getting this palpitation, then I'm having this pulsations, I'm not able to tolerate all these things. But he is never dying from this heart troubles. It is the syphilitic and psychotic persons who die suddenly from heart troubles. And the sodic patient has pulsations which shake the whole body, pulsations of heart which shake the whole body. Then, as we discussed, soda patient has aggravation after eating. So the abdomen feels full after eating, and there is much distension, like that of nux moschata, enormously distended after meals. And all the abdominal pains and all are ameliorated by heat. Then there is diarrhea, which is induced by overeating. Sodic patient, as we learned, that sodic patient has this characteristic hunger and he eats beyond his capacity. Hungry and eats beyond capacity. Then a sodic diarrhea, it is generally similar to the diarrheas that of aloe, then that of podophyllum, sulfur. These are all the characteristic, they produce the characteristic sodic diarrheas. This overeating causes a watery diarrhea, usually in the morning. That is why these are indicated. These are all usually aggravated in the morning. Soda has diarrhea, but the diarrhea is not persistent, whereas the constipation is persistent. It is not a persistent diarrhea, but the constipation is the very stubborn, very marked, persistent constipation. And in the urinary sphere, they will have retention of urine whenever the body gets chilled. Retention of urine when body gets chilled. In the sexual sphere, again functional disturbances in the sexual sphere. Now here, if we go through the chronic diseases, the main, suppose soda is in the latent state, okay. What is the triggering factor which brings soda to the sphere? Mainly it is the mental conditions like grief and sorrow. So a person may tolerate the extremes of heat. He may work like 12 to 14 hours a day, but still that person will not suffer if he is in a mentally in a very good condition. But whenever there is grief, sorrow, as in any unhappy marriage, that will produce more serious, more distressing symptoms rather than the actual surroundings. So whenever there is a mental turmoil, that will bring on soda to the outer sphere rather than the actual hardships. It is not the physical hardships that are affecting the patient to a greater degree. It is the mental hardship that the patient is unable to tolerate. Then skin is that there is a general roughness and the unwashed appearance of skin. This is characteristic again, the unwashed appearance and this roughness of skin. Before we complete the sodic part, I would like to tell a few manifestations which are again important. One is erysipelas. Since we were discussing skin, erysipelas. Erysipelas conditions are a combination of soda and psychosis, while impetigo, it is a combination of soda and syphilis. Another thing that we know of sodic patient is that sodic patient cannot stand. Standing is the worst position for sodic patient. If he has to stand, there is a compulsion, then he will lean on something for support. Why this is the characteristic? Because not because of any structural changes, not because of back pain or any leg pain or something like that. Because the sodic patient has a natural desire to rest. That is the characteristic. The natural desire to rest. That is why the sodic patient cannot bear to stand. Natural desire to rest with its characteristic restlessness. Another thing is weakness of the ankle joint. Weakness of ankle joint, it is a indication of presence of a syphilitic tint along with the sodic tint. So syphilis plus soda, this will lead to this weakness of ankle joint. This is in a nutshell the manifestations of soda. Now we will go to some parts related to the soda itself, but some new things, not the symptoms. Boninghosen had given list of antisodic remedies. There were 50 remedies. 16 among them were from vegetable group, one from the animal group, sepia. This is also known as animal carbon. Sepia is also known as animal carbon. And 33 elements were from the chemical group. Now, among these 50 remedies, only 3 remedies were such that when we compare their atomic weights are higher than the elements essential to construct the human body. Those are baryta card, baryta card, platina, and aurum. Baryta, we are classifying it into antisodic because of that when it is combined with carbon, baryta card. Otherwise, these three are having higher atomic weights than the elements essential to construction of human body. So these three can also be kept under, it can also be considered as falling into the antisyphilitic class. Now, if you note the radioactive elements that we are using in our materia, the radioactive elements, they mostly correspond to the action of the syphilitic taint, and they are classed as anti-syphilitic in action. The radioactive elements, they are generally anti-syphilitic in action. Now, there is manganese in accompaniment with iron. This has come somewhere as question, I don't remember, but this is very interesting, that whenever there is this deficiency of manganese, it will produce, manganese starvation will produce a sterility in male and loss of mother's love in female. This deficiency of manganese, this is a cause for loss of maternal instinct. Very important. Loss of maternal instinct. Now, the symptoms, this we will find in J.H. Clarke's Dictionary of the Metria Medica. Clarke has given the first mental symptom. It is peevishness and taciturnity with concentration in self. Peevishness and taciturnity with concentration in self. This is the first mental symptom of manganese, which was given by J.H. Clarke in his Dictionary of the Metria Medica. Then another metals that we find is, one is important is tin, which is associated to sense of taste. And we have cobalt and nickel. Cobalt and nickel, when they are lacking, they produce uh, diabetes mellitus. So these are some of the deficiency features. Yes, as I was telling about the baryta, baryta is a medicine of the antisyphilitic class. Okay, but this baryta carb, since baryta carb has its relation to the carbons, and carbons, the main indication for the carbon group is the burned out. In one word, this is the indication. So we can use baryta carb as an antisoric since it has relation with the carbons. Okay. So this is from the sodic part. That much is enough. Next, we will go to the latent soda. The latent soda's mental conditions are very, very important. Now, how, when soda is in a latent state, it comes to the core. When the soda is in a latent state, a slight shock to the vital energy, it will bring about the manifestations to the core. Slight shock to vital energy, and the manifestations come to the core. It can be due to any accident, it can be due to any exposure, there can be numerous different causes when the latent soda does not remain latent and it comes to the surface. Okay. Now the conditions. The strong characteristic of the latent soda is the mental condition. Latent soda is very alert mentally and quick and active in their motions. They have a pronounced keenness and activity of mind. Keenness and activity of mind. Very enthusiastic. What happens due to this enthusiasm is that for a short time they will work very much. um, Today I want to read Roberts. Okay, at a stretch I read 10 chapters. After that I'm so fatigued and I'm so exhausted, I do not open my books for another 10 days. This is the characteristic of latent soda. So they will work like trojans for a very short time, and then they are easily fatigued. If you do not maintain a consistency, if you work like that, obviously you will get fatigued. So they will get easily fatigued, both mentally and physically, and then they will have the desire to lie down. After this fatigue, they are so exhausted, so uh, what to say, so irritated that they will not undertake any exertion because of this fatigue. Another peculiar characteristic is that they will have flashes of heat when they are working. Flashes of heat when working, and the heat of the room, it oppresses them. Heat of the room, it oppresses a latent sodic patient. Another key word of latent soda person is the anxiety. Is the anxiety. Anxiety, there can be many sorts of anxiety. The main anxiety is that I will not be able to accomplish it. Suppose I make a to-do list that I have to read 100 books this year. I am not being able to accomplish it. That fear that I will not be able to read those 100 books, that is the anxiety that a latent soda patient will have. Then they can also have fear that if they get sick, they will die. Then when suppose I want to read this much books, maybe I will fall ill so that I cannot read it. It is another manifestation of this anxiety, that I will not be able to accomplish anything, that my body will give away when I want to accomplish this, then I will die when I am sick. All these irrational fears latent soda patient will have. And another fear is that they will be dependent. They will be dependent. So their anxiety can be of many forms. Unable to accomplish certain things, health will fail when they are when they will be like doing things, health will fail. Then fear of death, all these things are marked. And there is anxiety about the heart when stomach conditions are present. Anxiety about heart when stomach conditions are present. Fine. In children, there will be fear of dark, fear of strangers, fear of imaginary things, all these things. Fear of dark, fear of strangers, fear of imaginary things, all these peculiar things. Another one is that they have a difficulty to concentrate because they are very restless. They cannot be consistent on anything. As I told, there is no consistency. So they are very restless and they cannot stay put on anything. Due to this restlessness, they cannot even concentrate on anything. This restlessness is particularly noted at new moon and in women at approach of menses. This comes as MCQ question, this one. This restlessness will be there in new moon and in women at the approach of menses. Anger. The anger of sodic patient is also peculiar. There will be fits of anger, but they will not harm anyone. This is the purely sodic one. They will never harm anyone. Whenever this sodic base it is united with syphilis or psychosis, then there is a tendency to harm or kill others. Most cruelty is noted in the psychotic patient. Okay, most cruel is the psychotic patient. So whenever there is this sodic patient is angry, they will not have any desire to harm others. But when this is united with either syphilis or psychosis, they will harm others. Even they can kill others. Latent soda persons, they are hysterical and there is change of temperament without any apparent cause. Hysterical and change of temperament without apparent cause. Fine. Okay. I need one more slide. Just a second. Yeah. As I told that the greatest force to bring latent soda into this to the surface is grief or sorrow. This is the main triggering factor. Grief or sorrow, it will bring latent soda, will not remain latent anymore, and it will come to the surface. Okay. Then there is depression. In a latent soda person, there is depression of spirits. And unlike the other miasms, soda patient is not accustomed to silent grief. It is not that a soda patient will brood. They will burst out crying. After this, they will have relief. This outbursts of crying, burst out crying, and importantly, this crying relieves the whole conditions. Crying ameliorates or crying relieves. Okay. Remember that sodic patient, they are never accustomed to silent grief. Never accustomed to silent grief. Sodic patients, sodic manifestations, they are ameliorated by eliminative functions. Yes, see, ameliorated by eliminative functions. Like diarrhea, perspiration, free urination, these will relieve the patient. This will relieve the patient. In a psychotic person, this is again an important MCQ question. Psychosis, there is general elimination, there is general amelioration from unusual eliminations. Ameliorations from unusual eliminations through mucous surfaces. Through mucous surfaces such as leucorrhea, such as free nasal discharges. Malignancy, whenever malignancy is developed, it is due to the presence of combined stigma. Malignancy due to presence of combined stigmata. Important one. Epilepsy and true insanity. They are usually tubercular in origin, never purely soric. Epilepsy or true insanity. True insanity, generally tubercular. Tubercular is the grafting of syphilitic on a soric fault. This we know. Now, wherever there are multiple stigmas present, suppose soda, syphilis, psychosis, all the three miasms have been combined in a person, soda will be the first to appear. Soda stigma will be the first to appear, and soda will be the most outstanding. See, in a multi-miasmatic patient, soda always is the first to appear. And when we have to treat a multi-miasmatic case, always we will start with antisodic. Now we will go to the syphilitic stigma. This is, Robert says that syphilis is one of the comparatively modern diseases. And syphilis is, from its inception, a constitutional disturbance. It is from its inception a constitutional disturbance. And he has also named this as incubus, incubus of the system. We all know what incubus is. Now, whenever a baby is born with a syphilitic tendency, it is never in the primary stage. It is always in the secondary stage that the baby is born. And in the second generation, there are no primary local manifestations. In the second generation, there are no primary local manifestations. This is important. So when an offspring is born with syphilis, he will not show the characteristic chancre or the ulcer because it has got into the second generation, and there will be certain constitutional disturbances like deformities of teeth, then bone structure, ulcers, all these things. Now, syphilis is the easiest miasm to treat. Then mentally syphilitic persons are dull, heavy, stupid, stubborn, and fixed ideas. Whenever we think of fixed ideas, always thuja comes to our mind, but it is in syphilis that fixed ideas is more prominent. Now, syphilitic patient, they will as exact opposite to sora. Okay. They will keep their troubles to themselves and sulk over them, brood over them. So they suffers in silence, unlike Sora. And slowness of comprehension, it is marked. Slowness of comprehension is marked when they are starting to say something, the thoughts will vanish. They will forget what they were about to say. This slowness of comprehension will give rise to this sort of forgetfulness. The patient will start a sentence and he will forget what he was about to tell. And these patients are usually suspicious. Not that much suspicious like of psychotic patient, but still they are suspicious. Always syphilitic patients are worse at night. Always they are worse at night. And at night this restlessness is very much. Head is large and bulging. Opposite to Sora, there are deformities. Head is large, bulging, moist, gluey, greasy. And another thing which came in some RO question is that matting. Matting is characteristic of syphilitic miasm. Matting of hair is characteristic of syphilitic miasm. Then the certain eye manifestations, astigmatism, deformities of lens and cornea, refractory changes, all are characteristic of this syphilitic miasm. As we already discussed, that process of the lids is very much syphilitic, not soric, and this any neuralgias of the eyes and head, these also come under the syphilitic group. Neuralgias of eyes and head, they also come under the syphilitic group. These are all aggravated at night and aggravated from heat. Ears is characteristic. In Soric, everything was normal from the outer appearance. Here, everything is abnormal from the outer appearance. Ears are very large. Lobe of the ear is pale, white and transparent. Very, very important MCQ pointer. And cholera infectum types of diarrhea. This comes under the syphilitic group. Now we will compare this with the tubercular patient. This is the in a nutshell the syphilitic ones. Tubercular child, tubercular child is a problem child. Why problem child? Because the child is slow of comprehension, dull, and unsocial. He is generally not willing to talk or to mix in groups with others. In tubercular miasm, this one is very marked. General amelioration from nosebleed. In tubercular child, this nosebleed will ameliorate the mental symptoms. In child, nosebleed will ameliorate the mental symptoms. And in adults, nosebleed will ameliorate, will clear up old neuralgias. Nosebleed ameliorate old neuralgias. Headaches which come on Sundays or when they are away from their usual work. This is characteristic of tuberculosis. Sundays means when they are not doing their usual work. These are the combinations of soda and syphilis. And obviously, this is also ameliorated by nosebleed. So everything ameliorated by nosebleed is tubercular. High blood pressure. High blood pressure denotes to which miasm? High blood pressure is not purely sodic. When the soda is combined with syphilis, when there is combination of soda and syphilis, this is the high blood pressure is a manifestation. Okay, now we have this headache. Whenever there is a ravenous hunger before headache, it is again a combination of soda and syphilis. Ravenous hunger before headache, it is a combination of this tubercular taint. Syphilitic, we learned that syphilitic, the vertigo or the headache, it is those at the base of brain. Psychotic, it may also be there, but in tubercular, it is more marked. So vertigo is more marked, especially base of brain is syphilitic origin. In the tubercular diathesis, there is circumscribed red spot. So anything red, it is of the tubercular miasm. Red spots or on cheeks of adult or children. Another problem is hay fever. Hay fever, what is the miasm corresponding to hay fever? Hay fever, is a very problematic trouble. It has all the three miasms in play. Hay fever, soda, syphilis, psychosis, all three miasms are present at base. Putrid sweet taste in mouth. This is a characteristic of the tubercular diathesis. Whereas in syphilis, in pure syphilis, we will have a metallic taste in the purely syphilitic person. Metallic taste. This is important. So tasteless is soda. Putrid sweet taste, it is tubercular. And in syphilis, there is metallic taste. Craving for salt is very marked in the tubercular miasm. And again, tubercular, they also have a ravenous hunger, very much like soda. Craving for spirituous liquors. Craving for spirituous liquors is also so marked in tubercular that tubercular patients, tubercular diathesis persons, are the people who are apt to become drunkards. It is the craving for this liquors is so much that they are apt to become drunkards. Lymphatic involvement of abdomen. This is a tubercular one. And hernias also. There is a lack of muscle tone. These are all tubercular one. Tubercular persons, they cannot breathe well on going upstairs. There is aggravation from going upstairs like that of calcar, but there is no problem on going downstairs. Actually, not amelioration, but no problem going downstairs. Children cry out during sleep. Children crying during sleep, it is again a tubercular manifestation. Children cry during sleep, it is a tubercular manifestation. Tubercular child cannot assimilate cow's milk. It is due to the fact that they cannot tolerate this casein protein present in the cow's milk. So before they can digest it, this casein has to be modified. Otherwise, they will have loose stool. They will have this undigested card passing in the stool. Okay, shall take up a new slide. Hemorrhage from the rectum. Sign of this tuberculosis or tubercular diathesis. But bleeding hemorrhoids, it is not a sign of tubercular diathesis. Hemorrhage from the rectum and bleeding hemorrhoids both are different. Bleeding hemorrhoids is psychotic in origin. Bleeding hemorrhoids is psychotic. Then other tubercular manifestations are nocturnal enuresis, diabetic patient. Diabetic hypertension is tubercular. Diabetes is also tubercular. But when it is a very malignant sort of diabetes, then actually psychotic is also present in the background. So diabetes, the origin is tubercular, but when it is a form of malignant diabetes, then psychosis is also associated. There is a psychotic taint in the background. Tubercular nails are again characteristic. They have brittle nails with hangnails. This hangnail is another sign of this tubercular. This hangnails, sign of tubercular one, and nails are spotted with white specks. Spotted nails, sign of tubercular miasm. Phelons about the nails are tubercular. Phelons are tubercular. Syphilitic nails are paper thin. Syphilitic nails are paper thin, spoon shaped, and tears away easily. Bends and tears easily. Other tubercular manifestations are corns, hypertrophies. These are all tubercular manifestations. Corns, hypertrophies are all tubercular manifestations. So this nails is of tubercular nails. Chilblains. Chilblains is a combination of all the three miasms. Chilblains is a combination of all three miasms. Varicose veins. Varicose veins is having tubercular origin. Urticaria, it is also having tubercular origin. Varicose veins, then urticaria, these are all tubercular. Marked freckling, it is also tubercular. But remember again, psoriasis, not only related to soda, psoriasis has been called the marriage of all the miasms. Psoriasis responsible miasms are all three of them. Chilblains 3 miasms, psoriasis also 3 miasms. That is why it is called as marriage of all the miasms. Marriage of all miasms. Apart from this, any erysipelatous condition, any carcinomatous condition, then lupus, these are all again the union of all the three miasms. Impetigo we already discussed. And acute exanthematous disease, this is a manifestation of tubercular miasm. Acute exanthematous disease, manifestation of tubercular miasm. Now, whenever we find a patient who is healing very slowly, wounds which heal very slowly, this is due to the union of soda and syphilis. Slow healing wounds. Slow recovery of all complaints is different. It is psychotic. But slow healing of wounds, slight wounds that heal very slowly. Slow healing of wounds, it is soda and syphilis. But not slow recovery of all complaints. It is psychotic. And for the medicines, the ones we tell as antisyphilitic, if we see their atomic weights are much, much higher than the constructive elements. The radioactive elements, they are also, as we already discussed, they also come under the antisyphilitic group. Now we are left with the last one, the psychosis. We'll go to that one. Yes. So primarily, what is the difference between psychosis and gonorrhea? Gonorrhea is the acute infection of the gonococci. So gonococcus infection, gonococci, the acute infection which uh, takes 5 to 10 days to develop after urethritis, as urethritis after exposure, which develops within 5 to 10 days after exposure. This is the gonorrhea. Fine. Then what is psychosis? Now, whenever this gonorrhea is suppressed, and acute infection goes into the internal plane, then it comes as psychosis. So when it is externally suppressed, then only it is psychosis, otherwise not. Acute infection of gonococci is not this psychosis. It is gonorrhea, plain simple gonorrhea. Now the suppressed gonorrheal infection, it will first show up as anemic condition. Suppressed gonococcal infection, suppressed gonorrheal infection, it will first show as anemic condition, as an anemic condition. Then a general catarrhal condition develops. After that, an inflammation comes. Inflammation can be of any type. It can be an inflammatory rheumatism. Then inflammation can occur in the soft tissues. The whole organism can be involved. Then there can be the involvement of lymphatics. There can be stasis in the lymphatics. There can even be an inflammation in the prostatic gland. So these are the symptoms that are first produced after suppression. In the secondary, this is the primary stage after the suppression. In the secondary period, everything is of inflammatory nature in the secondary period of psychosis. Now, whenever this gonorrheal poison or the psychotic poison is transmitted into one person to another, it is transmitted in the stage in which the person is infecting. Suppose the person who has caught this infection, person A, has caught this infection, it has been suppressed. Now it goes to the second stage. Now when he infects the person B, this person will contract it in the second stage only and not in the first stage. This is very characteristic. So when A has got over the primary manifestations, goes to the second stage, infects a second person, the second person will have been infected in the second stage itself. Now this psychosis, this is a forerunner of carcinomatous conditions of breast and uterus. Very important. It can also be diabetes, can also be a forerunner of diabetes and numerous other diseases. As I told that slowness of recovery is characteristic of psychosis, but not only slowness to heal wounds, that is different. In mental sphere, the patient is very, very suspicious. Suspicious comes to that level that even he even doubts himself. He does not trust himself. The suspicion comes to this level. So he goes back and repeats after saying something. He will think that did I really say it? Did I really do this? It is that sort of suspicions. Then there is a very, very worse form of jealousy. Psychosis patient, suppose, tells someone to tell something. Suppose a psychotic student, he tells a person, suppose a person A who is psychotic, he tells a person B that please convey my message to the teacher. He told him to convey a message. After telling, he will always think, he will always worry that whether he has given the correct information or he has suppressed some facts or he has told something wrong. It is like that. Tendency to harm others. Never like sorry. He has tendency to harm others and harm animals even. And they are having the worst form of insanity. Worst forms of cruelty and cunning, deceit, worst forms of mania. Worst forms of mania. Now, the criminals and criminally insane. Criminals and criminally insane, they are never sodic, either psychotic or syphilitic. Either psychotic or syphilitic. This is a symptom of graphitis, okay, but actually of the psychotic miasm. This comes. He forgets recent uh, happenings, but he will remember distant events. He will remember what to say, very old events very clearly. And psychotic patient is very absent-minded. Here also you will find fixed ideas, more characteristic in syphilis, but also over here, and same slow mental power. Slow mental power. I'll take up a new slide. Psychosis, along with soda, it is the basis of most criminal insanity and suicides. Basis of criminal insanity and suicides. Now, psychosis has amelioration from unusual discharges. Whenever external manifestation occurs, there is general amelioration. They are markedly ameliorated by return of acute gonorrheal manifestations. Acute gonorrheal manifestations. But natural ameliorations like urination, diarrhea, perspiration, they do not ameliorate. It ameliorates in case of sodic patient. Natural elimination in case of psychosis does not ameliorate. Headache we discussed earlier. Headache in the vortex is psychotic origin. Headache in vortex is of psychotic origin. It can also be frontal headache. And these are aggravated by lying down at night. Lying down at night and aggravated after midnight. Okay. Hair will fall out in circular spots. Hair falls out in circular spots. Hair of the beard even falls, but there is not the matting of syphilis. So matting is exclusively present in syphilis. In syphilis, this hair falls out in bunches. This is of psychotic. In circular spots, it is psychosis. But in syphilis, again a differentiating point, hair falls out in bunches. In a syphilitic patient, this hair fall, it begins in the vertex, then goes to temples, then to temples. And in soric, hair will fall out after illness. In soda patient, hair will not fall out like this circular bunches, but hair falls out after illness. So by this hair fall only we can differentiate it is present in which miasm. Hair falls out after illness, and since the psoriatic patient's scalp is very dry, it will break and they will have split ends. It breaks and ends split. Then in psychotic, there is a red nose, except this red nose with prominent capillaries. Other than that, other red are all features of red lips and all. They are features of red spots in the cheeks. They are features of tubercular miasm. But red nose with prominent capillaries, this is a feature of the psychotic miasm. Sense of smell is lost. In psychosis, sense of smell is lost. Snuffles. Snuffles can be either syphilitic or psychotic. Psychotic patient generally has moist snuffles and generally with the odor of fish brine. Odor of fish brine. Psychotic patient will crave beer. As we discussed earlier, that erysipelas, it is a combination of sodic and the psychotic stigma. Then abdominal complaints. Abdominal complaints are generally colic in nature. Whenever colic is present, like that of colocin, which is ameliorated by bending forward, this is a characteristic of psychotic miasm. Along with that, there is a marked irritability. In colocin also we find, so there is a associated with marked irritability. It is a feature of psychotic miasm. Psychotic patients are generally obese, and obesity, from this obesity they will have this dyspnea. Generally the obesity, the hyperventilation syndrome we name as Pickwickian syndrome. So if I ask you that this Pickwickian syndrome, it is a manifestation of this psychotic miasm. Sour smelling child, the child is sour smelling in all the ways, and the psychotic baby, they want constant attention along with those characteristic colic. Constant attention. Then pelvic inflammation. pelvic inflammation, all sorts of inflammation in the ovaries, inflammation in the fallopian tubes, then cyst of the ovaries, uterus, fallopian tubes, everything, it is related to psychotic miasm. Appendicitis is even related to psychotic miasm. Appendicitis is related to psychotic miasm. Even general peritonitis, general cellulitis, these are all characteristic of psychotic miasm. Characteristic of this psychotic miasm. Along with that, we know that psychotic patient will have rheumatic conditions. Rheumatic conditions, these are aggravated from rest. In psychotic, these rheumatic conditions, these are aggravated during rest, aggravated during damp weather, when the weather is cold and damp, and ameliorated in dry weather and stretching the limbs or moving. Ameliorated from moving or stretching, ameliorated in dry weather. Characteristic. Apart from that, herpes zoster. Herpes zoster, it may seem that it is a syphilitic one, but no, it is a psychotic one. It has got a psychotic base. And barber's itch. Barber's itch develops in psychotic patients. It is also a manifestation of the psychotic one. So we have come to the last part. Now, if you have any query, you want me to repeat anything, anyone, you can tell me, no problem. So, in the summary, we will just take 2 or 3 lines. When suppressed, when this syphilitic stigma, when it is suppressed, it takes itself on the meninges of the brain and affects the larynx and throat, the eyes, bones, periosteum. Sora goes on the nervous system and nerve centers, nervous system and nerve centers, and these are all ameliorated by surface manifestations. Surface manifestations. And psychosis attacks the internal organs, especially the pelvic and sexual organs. Pelvic and sexual organs. Here we find the worst forms of inflammation, infiltration of the tissues causing abscess, then cystic degeneration, then hypertrophies, and in the mental sphere, dishonesty, suppression of this psychosis. In the mental sphere, it causes dishonesty, moral degeneracy, and mania. Now, one thing I forgot to tell in psychosis is that mania patients, when they have got some kind of operations, after operation, they tend to have abscess in the region of the stitch. Okay, stitch abscess. It is not syphilitic, it is psychotic. Stitch abscess will never occur in a patient if the patient does not have a psychotic base. So a patient after operation develops a abscess in the area of the stitch abscess. It is having psychosis in the background. So that is all for today's session. Thank you all.